Hello and welcome to the TMJ Case Study. I'm Cole.
I'm Dima.
I'm Grace.
And I'm Zach.
Sam, a human anatomy student, spent much of his weekend studying for his muscle laboratory practical. Given his long study hours, he was exhausted on Monday morning and could barely stay awake for his 8 a.m. theology class. After only 15 minutes, he began to doze off. When the lecture was over and Sam was awakened by his fellow students, he let out a massive yawn. However, when he tried to close his mouth, he couldn't. His jaw was locked open. How terrifying. His parents scheduled an emergency appointment with Sam's dentist. This wasn't the first time this had happened. Sam had a history of headaches and dizziness on occasion. He hears non-painful clicking noises when opening and closing his mouth. His roommate also reports being awakened at night to the sound of Sam grinding his teeth. Ouch. Some of the symptoms Sam experiences is locked jaw, headaches, dizziness, clicking noises, and loud grinding of his teeth at night. His diagnosis: we determined that Sam is suffering from bruxism based on his combination of symptoms. This bruxism is also most likely causing temporomandibular disorder, TMD, in the temporomandibular joint.
So what is bruxism? Bruxism is classified by symptoms that include clenching, grinding, or gritting during the day and or grinding or tapping reported by a sleep partner, masseter hypertrophy, tooth wear and hypersensitivity, morning muscle stiffness or pain involving the masticatory muscles, clicking or locking of the temporomandibular joint, tongue indentations, scalloping, and dull headaches. The temporomandibular joint is a modified hinged type of synovial joint made of the condylar process of the mandible and the mandibular fossa of the temporal bone. The surfaces of the joint are lined with fibrocartilage, which is unusual for a synovial joint because most are lined with hyaline cartilage. The main components of the temporomandibular joint include the joint capsule, articular disc, mandibular condyles, articular surface of the temporal bone, temporomandibular ligament, stylomandibular ligament, sphenomandibular ligament, and the lateral pterygoid muscle. Ligaments of the joint include the lateral ligament, which runs from the beginning of the articular tubule to the mandibular neck. It is a thickening of the joint capsule and acts to prevent posterior dislocation of the joint. The sphenomandibular ligament originates from the sphenoid spine and attaches to the mandible. Stylomandibular ligament is a thickening of the fascia of the parotid gland, and along with the facial muscles, it also supports the weight of the jaw.
The temporomandibular joint moves in a few different ways. Protrusion and retraction are the first two. The upper part of the joint allows protrusion and retraction of the mandible and the anterior and posterior movements of the jaw. The lateral pterygoid muscle is responsible for protrusion, assisted by the medial pterygoid, and the posterior fibers of the temporalis perform retraction. A lateral movement, either for chewing or grinding, is achieved by alternately protruding and retracting the mandible on each side. The other two kinds of movements are elevation and depression, which the lower part of the joint permits elevation and depression of the mandible, opening and closing the mouth. Depression is mostly caused by gravity. However, if there is significant resistance, the digastric, genhyoid, and myeloid muscles assist. Elevation is very strong movement, caused by the contraction of the temporalis, masseter, and medial pterygoid muscles. While there is not much chance for peripheral nerve injury, about the only thing that could cause it would be tooth nerve damage caused from the grinding of his teeth, determined by the tooth damage and level of eroding, should it get to that point. So what are some of the treatment options for bruxism? Oftentimes children grow out of bruxism, but if not, there are a few possible things we can do. So in terms of dental, we can use splints or mouth guards to keep the teeth separated to avoid damage from the clenching and grinding, or dental correction in extreme cases where the tooth wears down to sensitivity and inability to chew should that happen. Some of the medications that would be used for bruxism would be things like muscle relaxants or Botox injections, or medication for anxiety and stress to help deal with the stress that could be causing some of the bruxism. Some other approaches include stress or anxiety management. So, bruxism, if it is caused from stress, you can learn how to prevent the problem by using strategies like relaxation and meditation, or seeing a licensed therapist or counselor. Some behavior change could also help with the bruxism, changing things with proper mouth and jaw position specifically. And some biofeedback. This, uses monitoring and procedures and equipment to teach you how to control the muscle activity in your jaw properly.
Okay, so there are some tips for prevention of bruxism and TMD. One of them is night mouth guards. These are suggested to help protect your teeth, muscles, and temporomandibular joints when there's excessive force imposed on the jaw when people are grinding their teeth at night. Medication can be prescribed for anxiety to prevent the onset of symptoms for bruxism and TMD. You can also avoid foods and drinks such as soda, coffee, and chocolate that contain caffeine, and this can assist in the prevention of bruxism because the continuous motion of chewing and having the jaw repetitively being forced into that type of motion is also something to use for prevention. And then self-training to constantly remind yourself not to clench your teeth or to quit clenching your jaw is something to be conscious about when trying to prevent bruxism and or TMD. And then finally, adequate sleep can help with many everyday functions. Okay, there's also new research coming out surrounding bruxism, and one of the articles we looked at was looking at contingent electrical stimulation, which is also called CES, and this attempts to reduce the activity of mastication muscles during sleep bruxism. So CES applies low levels of electrical stimulation in response to muscle activity in the jaw or clenching of the jaw. And in 2 studies done, researchers found a reduction in EMG episodes per hour during sleep when using CES. So there's a reduction in sleep bruxism. The research on electrical stimulation shows a decrease in contraction of the muscles in the jaw, and it ultimately found that stimulation allows the decrease of EMG activity generated by the muscles, which is super important because that's the main reason that bruxism occurs. Researchers have also been looking at myofunctional therapy. This targets the facial muscles that are used during chewing and swallowing. The exercises used in this therapy are meant to improve the strength of the muscles in the jaw and tongue, so it reinforces proper tongue position, and the muscles of the face and mouth are repatterned in order to promote proper function and positioning. So this is like behavior modification. And it also addresses proper head and neck posture.